Well, welcome everyone to our 6th RxTalks webinar, brought to you by Omeda Rx. We're happy to have you join us today, and we have our resident speakers, our own Dr. Lam and Rich Adams, and a special guest speaker, Dr. Sean Karbowicz. My name is Dana Madison, and I'll be one of your moderators, joined by Allison Donahue. We'll be keeping things running behind the scenes. Today, I'll go over some housekeeping items, share the answers to our poll questions from the registration page, introduce our speakers, then pass them over to our presenters. And at the end, we'll wrap up with a question and answer session. Out of respect for our presenters, everyone has been automatically muted. We received some questions in the registration process, and those will be covered throughout the presentation and in our Q&A session. We will capture additional questions throughout the presentation using the dialog box. Simply submit your questions and we will send them to the presenters to read and answer later in the presentation. Today's session will be recorded. Now for the fun part. Several of you answered our poll questions when you registered. Thank you for doing that. Now for the answers. For question 1, what percentage of millennials use social media for health-related purposes? 8% of respondents selected 22%, 25% of respondents selected 46%, 63% of respondents selected 65%, and 4% of respondents selected 37%, which was actually the correct answer. Great job. For our second question, what is the #1 driver for customer satisfaction and loyalty? 4% of respondents selected brand, 50% of respondents selected value, 5% selected technology, no one selected simplicity, and 27% of respondents selected trusted advice, which is the correct answer. Great job, and thank you everyone for participating. We had several responses, and it's pretty fun. Look for more opportunities to engage in future webinars. As mentioned, our speakers today are Dr. Steve Lam, Dr. Sean Karbowicz, and Rich Adams. Dr. Steve Lam currently serves as a clinical pharmacist client manager for Omeda Rx, where he has strategic responsibility for developing, communicating, and reporting the outcomes of clinical initiatives impacting both cost and quality of care to members and clients. Prior to joining Omeda Rx, Dr. Lam was the resident pharmacist at a large health plan in Oregon, where he was exposed to a variety of roles, including formulary management, prior authorization, government programs, and specialty pharmacy, as well as clinical operations and administration. Dr. Sean Karbowicz serves as the general manager at MedSavvy, where he oversees the overall business strategy. As a passionate innovator in pharmacy, Dr. Karbowicz has championed best practices that evaluate scientific evidence to predict the performance of medications. Dr. Karbowicz founded MedSavvy when he saw an opportunity to put cost and quality information in the hands of patients and their providers. Rich Adams currently serves as the Director of Product and Business Development at Omeda Rx, where he oversees sales, account management, and product development. Before coming to Omeda Rx, Rich held various sales leadership positions at industry-leading healthcare companies. Rich's career work focuses on helping organizations navigate the new health economy. With that, I'm going to hand it off to Rich Adams. Rich, take it away.
Hey, thank you, Dana. Welcome back all to RxTalks in 2017, and a special welcome back to Dr. Lam and Dr. Karbowicz. Thank you both for joining. Today, we are tackling this idea of engagement. What is it? How is it changing? Who's involved? The people, the technology, the processes, the skills, and the knowledge that's involved. We'll discuss the overarching market forces that are driving the need for this change, the role of evidence-based medicine in engagement, and we'll have an in-depth review with Dr. Karbowicz of an engagement solution in the market today called MedSavvy. Let's start and return to our common context that we began with back in September of 2016. And we talked about the undeniable change that has occurred in healthcare. And it is simply a dramatic rise in cost for pharmacy spend. And we talked about forecasts for increased spend through 2025 to be at a 6.9% annual compound growth rate. That's $312 billion in 2016, and that is a dramatic change from what has gone for the previous decade. And what you're looking at here is another depiction of this increase in cost, shown here as trend. And you can see back in 2003, we had a fairly significant trend when it came to pharmacy costs, a little over 14%. But managed care, primarily brand drugs converting to generic, actually drove that trend way down to its lowest point in 2011. But then in 2012 and forward, we've seen this dramatic increase, starting with hepatitis C, and the specialty products were released then, and continuing through, forecasted to 2017, we were going to realize somewhere around a 12 to 13% increase in cost for pharmacy, back to what it was in 2003. This is an undeniable change that has occurred. And we've talked about what is driving this change. And so there are some key factors that we talked about. Certainly we talked about inflation, simply the costs or the prices of medicines increasing. Examples include erythromycin, Glumetza, EpiPen, things that we all have read about in the press. We've talked about specialty drugs. Just last 2 weeks ago, a new specialty drug was approved by the FDA called Spinraza, $750,000 for year one, $350,000 for every year after that. Very, very expensive drug from a specialty side. We talked about the FDA continuing to accelerate their approval processes for medicines, getting them to the market more quickly. And certainly we talked about advertising as being a key driver. The idea that these medicines are so expensive to develop that pharmaceutical manufacturers are looking to reach their peak performance in terms of market capture as quickly as possible, and then going to direct-to-consumer, direct-to-provider, television advertising, and the dramatic increase there. So we have seen some pretty significant cost changes, and then we've talked about the drivers for that change over time. Let's talk a little bit about how healthcare and how pharmacy looks in terms of similar industry, and let's turn to Dr. Lam. And so we see over the last 25 years, innovation, productivity, engagement has transformed other industries. We look at the travel industry, for example, and on this slide you can see that you've got a round-trip airfare at one point cost $835, but then over time the industry has been able to drive value, reduce control costs, increase quality, and they've driven that price down to about $217. The cell phone industry is something very similar to that. At one point it was about $5,100 annually. Now we're looking at about $649, $650 annually. And they've done this through innovation, productivity, engaging the consumer, driving more value to the consumer. And so Dr. Lam, when you look at these industries and then you take a look at the healthcare industry and pharmacy in particular, what are you seeing? Do you see an opportunity for change here?
Rich, that is a really good question, and thank you for having me again. So to answer that question, we have seen significant improvements in other industries, as you've mentioned, such as travel and computer, but we haven't quite seen that same level of engagement within the healthcare industry. And as advancements in technology are happening and more drugs are being approved, we're actually seeing the price go up. So as healthcare and pharmaceutical drugs are getting more complex, prices have not gone down, and they can continue to climb. And so what we're needing now is more effort by the hospitals, insurers, payers, and pharmacies to improve health literacy and help patients be more engaged in their healthcare. Some might argue that we might have too much information now, and because today's patients can go online to the website to talk to their doctors and pharmacists and even their next door neighbors to get information. So what we need is really a more coordinated effort, a more thought out approach to make things more simple and easy to understand. We have reached this point, and our goal really is to bring costs down through improving engagement for our customers.
So it sounds like, and it looks like, there's a great opportunity within the healthcare space to to introduce through engagement efficiencies, improved communication, improved processes, simplifying the overall experience, and the end result is we'll have an impact on cost and the ability to impact on the pharmacy side to a certain degree that dramatic 6.9% compound annual growth rate in pharmacy spend.
Absolutely.
So let's talk a little bit about engagement. So in 2014, Dr. Lam, the National Patient Safety Foundation calculated the annual cost of poor health literacy at around $58 billion per year. That is a truly astounding number. And if we take a look at that within the context of the earlier chart, that's about 20% of drug costs in the United States can be attributed to poor health literacy. Certainly solving this would help manage costs, but first, can you help us understand what role does literacy play in engagement, and what role does literacy play in pharmacy?
Yeah, so health literacy plays a significant role in engagement. When we look to actually define health literacy, there really isn't a universally accepted definition. But generally what health literate individuals do is they're someone who can obtain, process, and understand basic information to make informed healthcare decisions. So in terms of pharmacy, these are the types of patients who know what their medication is for, how to use that medication, and why they're on it. In order to reach this baseline level of health literacy, the individuals need to be engaged in their care. So health literacy really does play a significant role in pharmacy, and pharmacists are in a perfect position to help patients understand their medications and their condition. So as you alluded to earlier, Rich, poor health literacy can cost up to $58 billion per year, and this places a significant strain on our healthcare system. Poor health literacy can lead to things such as increased healthcare costs due to lack of adherence to medications, persistency in taking medications, the use of lower value medications, and medication errors. So patients who don't understand how to take their meds are more likely to stop their medications due to a side effect. So this in turn could drive up costs and lead to more hospitalizations. One thing to note is that poor health literacy really isn't a new phenomenon that we're dealing with nowadays. We have been battling health literacy for many years now by pushing more and more information onto our patients. So when you go to a pharmacy, for example, patients are probably used to getting a 10-page printout explanation on their medications. Or when they go visit their doctors, they might come home with pages and pages of discharge papers. This shotgun approach hasn't really been that effective as much as we've hoped. But what we're seeing now is more of a paradigm shift to be more patient-centric and to take a more holistic approach. We are getting more granular and looking for ways to improve health literacy through the use of different consumer engagement tools. Those are just some of the things that we're dealing with in pharmacy and healthcare today.
That's interesting. So if Dr. Lam, if you could describe the ideal fully engaged pharmacy consumer for our audience, what would it look like for you? What is it that we're aiming at?
Yeah, so for the engaged pharmacy consumer, there's typically three common characteristics that I see. The first one being they ask questions. They want to know the who, what, where, and why around the medication. They are concerned about the value of the medication or their treatment. And they also want to understand the facilities or the doctors. Are they getting the best quality for their service or for the value? The second characteristic is they always respond and adhere to a treatment plan. So for patients, for example, who deal with conditions such as diabetes or high cholesterol, they will act upon their doctor's advice. They will choose better lifestyles, have better dietary choices, and exercise. And the last characteristic that I see in an engaged pharmacy consumer is they always do their research. So you probably know someone nowadays who will use Dr. Google or go onto WebMD to research their symptoms prior to actually going into the doctor's office. And what these consumers are really doing is trying to assess, well, what is the value? Is what I'm dealing with really worthwhile going to the doctor's office? So we really need to have more mechanisms to make things easier to understand for the patients to get them more engaged. And research really has shown that engagement leads to greater uses of preventative care services, or they don't delay their seeking of care. There's more positive relationships with the providers. So all those 4 bullet points that you see on the right-hand side right there will actually improve due to better patient engagement.
So patients are actively engaged in managing their health care is what I hear you saying.
Absolutely. They are, but we still need to have better tools available for them to be more engaged. I think health literacy is definitely improving, but we're making small improvements rather than big improvements, which is what we need.
Now, we couldn't talk, or we can't talk about engagement without putting ourselves in the shoes of the consumer or the patient and understanding how their world has changed over the last decade or so. And so if you could describe for us, what did it look like a few years ago in yestercare, and what does it look like today for a patient, and how can a patient or a consumer actively engage and manage their condition or their health?
Yeah, if we think about yestercare, that was a time when patients really just followed doctor's orders. They would go into their doctor's offices, get diagnosed, get a prescription, and fill that. Fast forward to today, care has gotten a little bit more complicated, but the great thing is that there is more people involved in that care. Instead of having this one-to-one relationship, we now have a one-to-many. So for the patient, the care is now being more holistic. The support network has grown significantly, and so has their engagement network. I think if we look at specialty pharmacy, this is a great example of how engagement has really improved from a pharmacy perspective. As we've discussed in previous RxTalks, specialty drugs are those that require unique medications to treat very complicated conditions, which requires unique handling and special monitoring. So for specialty pharmacies, they have nurses, pharmacists that can call the patient to talk to them about their medication. They also have the ability to send out flyers and informational pamphlets with information to help the patients understand their medication. They have technicians or care coordinators who can reach out to the patients to make sure that they're taking the meds correctly. And if they have any questions, they can be warm transferred over to a nurse or a pharmacist to immediately address these concerns. Certain specialty pharmacies can also have calls or text messaging or emails even to remind patients to take their medications or refill their medications. So it's a very coordinated approach. And really, it might seem like this is a shotgun approach because there's so much different mechanisms in which we reach the patient. But because we have these care coordinators to kind of wrap everything up and bundle it together, it's more of a white glove, handheld approach that we take with all these patients now in specialty.
That's interesting. If could you provide an example of let's pick a condition. Let's pick multiple sclerosis. What was it like from an engagement, a one-to-one, as you talked about in yestercare, and now one-to-many? What is it like today, and how is that different? Just to highlight in a specific example for our audience.
Yeah, multiple sclerosis is such a complex disease, right? So in yestercare, the patient would have gotten a prescription from the pharmacy, and basically they were expected to know how to take the medication. And if they had any questions, there wasn't really a point of contact for them to reach a physician or a pharmacist to better understand. Fast forward to today, if the patient is getting a multiple sclerosis drug, they will likely be getting that drug from a specialty pharmacy where they have all these tools available for them. And on the onboarding process, there will be a lot of tools to help them understand, but even after they start taking the medication, they have concerns or they're not quite sure, they can just pick up the phone and call the specialty pharmacy where they can be routed directly to a pharmacist. The great thing about specialty pharmacy is also they have what is called telehealth now. So if the patient wants to have a more one-on-one type conversation with a pharmacist, we have these web-based platforms where the patient can have a live video chat with the pharmacist or a nurse to address these concerns, to make sure that they understand how to take the medication. So things are evolving and evolving at a very quick pace, and multiple sclerosis within specialty pharmacy is a great example of how things have evolved.
Thank you. That was a good description of a condition-specific situation and how care has changed over time, Dr. Lam. I know that a great deal of research has gone into not only developing programs and processes that wrap around a patient or a consumer, but also into understanding consumers' behavior specifically and consumer engagement preferences in other industries, such as the hotel industry, financial services, the travel industry we talked about. And we've seen an explosion of engagement and empowerment tools, each tailored to varying age groups across those industry verticals. What can be said about consumer engagement by age group in the healthcare space? Do you see that having is that a tremendous opportunity from a literacy and engagement standpoint? Is something that needs to be paid attention to?
Oh, that is absolutely a huge opportunity for us. So as you can see from this diagram, not all individuals engage in healthcare the same way, and especially in pharmacy as well. So just looking at the different age bands, the millennials, which are typically the 18 to 24, versus the age groups which are around 65 and above, will engage very differently. Millennials typically prefer to engage through technology, while the older populations will typically prefer a more traditional face-to-face approach within a facility, such as a doctor's office or a hospital. We are seeing this growing trend right now of more active healthcare consumers who are more tech-savvy and want better digital engagement tools. We actually had a great audience question asking about how employers can get their employees involved. And I think really the first step is to sit down and try to understand who your employees are and how they want to engage. A workforce that is younger, who is primarily based out in the field, will likely need something that is more mobile to fit their lifestyle, whereas a population that is typically more of a traditional mindset, such as those who work in a brick and mortar type setting, will probably need something that is more local. So maybe they can send somebody to a luncheon to describe how to better utilize a certain website, etc. So we really need to understand the ecosystem before we can develop or provide the tools to these people. And we really need to understand so we can meet the end user where they are. As we have mentioned before, the healthcare industry is changing and becoming more patient-centric, but historically, PBMs have utilized phone, mail, and faxes as a way to connect and engage their members. We are now realizing that this is only a piece of the pie. So if we see this diagram right here, the phone, mail, and faxes piece really only account for about 18% to 90% of the preferred engagement tools. So PBMs who are ahead of the curve are now adding mobile applications, email, online portals, and partnering with other vendors such as hospitals to engage members to close that gap in health literacy. What these resources are helping members do is understand the value, so what are the dollars for within my care? The quality, is this doctor that I'm seeing the best for my given condition? And they're also helping them manage their conditions better by having refill reminders and doctor's visits reminders.
Sounds like it's an emerging business model that that the healthcare industry is taking best practices from other industries and applying it to its industry to really drive value and to drive engagement and improve cost positions. Is there a specific example within the pharmacy space that you can give about how a PBM has applied these different channels and different media and different tools to really drive engagement?
Yeah, so within the PBM setting, when we make formulary changes, I've seen certain PBMs will post that information on their website. So historically, instead of just reaching out via one method, which is sending out letters to their members, letting them know that this is changing, we now have platforms online so they can read and see that transparency within the digital space to really understand why this decision was made and how this is going to impact them. And we're going to see more and more of these types of tools being available, and we're going to see more leverage of that digital and that technology side to engage our consumers in the future.
Thank you, Doctor. As there's no doubt, you've mentioned technology several different times, there's no doubt that technology is disruptive, and it plays an absolutely critical role across all industries in terms of creating opportunities to drive value. And it plays a particularly critical role in engagement and behavioral change in the healthcare space. Dr. Lam, what would be your perspective on technology and behavioral change in the healthcare environment? And do you see it varying by different cohorts of age groups or different classifications of people who have conditions, chronic conditions versus acute conditions? How would technology have an impact here?
Yeah, that technology has a significant impact in patient engagement because technology is an enabler and an accelerator. It enables the patient to really understand what their condition is for, and it also accelerates that behavioral change. So once they understand their given condition, they can make modifications to their therapy or to their lifestyle to make sure that they get better health outcomes. And as we've seen in a lot of different industries, advancements in tech have really skyrocketed consumer engagement. I think one great example of this is websites like Amazon.com, where the consumer can read or write reviews about a product, helping them make more informed decisions on what they want to buy, such as the quality of the product. Is it worth the price, or is there something cheaper? These types of engagement tools are growing in the healthcare space, and in fact, Dr. Karbowicz is going to be talking about a very exciting product that will be transformative in how patients choose the best medications for them. I think this diagram does a fantastic job of showing how tech is enabling our patients to make better decisions and accelerating that behavioral change. Because on the previous slide, we have seen that different age groups will prefer different methods of engagement, but this slide is really affirming that a tailored approach is making a significant impact. So for our millennials, that 34% and 43% that we see here, think that technology does accelerate their engagement a great deal and to a moderate amount. So, but you might be wondering what kind of tech does this include, and really it can range from something as simple as a Fitbit or a mobile application to something a little bit more complex, such as a Bluetooth-enabled blood sugar monitor that can create logs to help patients have meaningful conversations with their doctors and adjust their treatment plan. So one thing to really remember is that across all age bands, however, our consumer engagement tools really need to be simple, usable, and accurate. It doesn't matter how advanced our tools are. If it isn't simple, usable, and accurate, the uptake of it is probably going to be pretty low.
Oh, that's a great segue. And turning now to Dr. Karbowicz, we've talked at length about the undeniable change that's occurred in the healthcare industry and the employee benefit space, and we've talked about literacy as being critical to that change and improving health literacy. We've talked about the definition of engagement. We've highlighting both the costs of poor literacy and poor engagement and the opportunity presented by other industries. We talked about segmentation. We've talked about technology. Let's now turn to Dr. Karbowicz and discuss an engagement strategy that he has deployed within his organization through an innovative technology. Dr. Karbowicz, welcome. Thanks. Great to have you. Appreciate you taking time from your busy schedule to join us. How does your organization view engagement within the healthcare ecosystem, and what are some of the critical success components that you've built and implemented?
I think, thanks, Rich. I think Steve pointed out a lot of the critical aspects of engagement. Certainly thinking about people where they are, how they like to be communicated with, how they like to communicate themselves. So certainly asking people, frankly, how they want to be communicated with is a great way to get some actionable insight on how we can communicate health information to people. So when we think about, from MedSavvy's perspective, how do we get people the content that they could use that we think is actionable for them and for their doctors, one of the first things we're going to do is ask people how can we communicate with you best.
And how do you go about doing that using technology and engaging folks?
So maybe what I could do first is sort of introduce MedSavvy for those who don't know exactly what it is, and then I could describe a little bit about what we're doing in terms of engaging individuals with the platform, with the product. So MedSavvy is really a service that provides information about medication options. So what we're doing is we're curating clinical effectiveness information, so safety and effectiveness, the clinical value of a product, along with personalized pricing information. So people know, under your prescription benefit, what are my options and what do they cost? What are clinical options for me? What do they cost? And what's a good option for me? So that's really what MedSavvy is aiming to do, and we do that through two channels. And on the slide that's being presented right now, on the left side of the screen, the first channel, in order to reach patients, is we're working with employers. We're working through employer-sponsored health plans as an aggregation of patients, if you will, and reaching out to patients in that way to get them the information they need. And then the other side of the channel, the other channel, is through providers, because when we're talking about prescription medication, obviously providers, physicians, prescribers of medication are the ones making the decision along with the patient about which product to use. So we have to have them at the table as well. So when it comes specifically to engaging patients with a product like MedSavvy, the first hurdle we have is just making them aware of it, right? And what does this tool have to offer? So we're working very closely with the employer who is sponsoring the health plan to work with them to reach their customers, their employees specifically. And as you can imagine, we work with employers in a variety of industries. And you can have employees who are primarily spending their time on a computer and they have access to email. There are employees who spend their time in a kitchen or in a warehouse and aren't using the computer and email all day. So the first step for us when we're engaging patients and engaging our customers is we ask the employer, how do you best communicate with your employees? And we learn from the employer what works for them, and really it's through that initial conversation with the employer is how we learn how we can introduce those individuals, the individual employees, the individual users, to MedSavvy. So that's really the first step, is just making people aware of what MedSavvy is and what it has to offer. The next step in engagement, as I mentioned, is once we have a message for our individuals and we're able to make them aware of MedSavvy, the next step is asking an individual, how do you like to be communicated with? How do you like to communicate with us? Establishing that relationship is really the first way to is the first step in being successful in terms of having a dialogue with an individual patient or an individual user of our products. Steve mentioned health literacy, and as a managed care pharmacist, I remember hearing other people within our industry talking about educating patients and helping them understand their benefits. And that can be done in two ways. One is we can inform individual patients and employees about their benefits in our language and our jargon, if you will. The other way, and what the MedSavvy approach, frankly, is we're meeting people where they are. So how do you like to be communicated with and to, and hearing what the individual's preference is, and then matching the communication style to the preference of the individual user. So, Steve mentioned how technology can help improve communication, improve engagement, and this is just one way. We can personalize messages, we can personalize communication channels and methods to more effectively reach patients, reach individuals, and give them the information they need to take action on their health.
I think that's very interesting. It's in hearing you talk several times, I know that you are pushing MedSavvy or leading MedSavvy to really change engagement or our perception of engagement in an innovative way, and you're looking to also accelerate behavioral change very collaboratively by taking a look at multiple channels, the provider component to it, the employer component, and then the individual consumer component to it as well. It's an extremely compelling business proposition that you have. When you look at helping people make better decisions and helping them to make accelerate their decision-making process, can you walk us through what MedSavvy is doing in terms of helping people make better choices, better health, lower costs, and what the engagement model actually looks like?
Yeah, that's great, Rich. So, I mentioned that the first step is really to raise awareness of what MedSavvy is. We're not yet a household name, but we're getting there. So the first step is really just to make people aware of what we are, and that's what we're describing as sort of the first level of engagement, is just getting people on the platform, the first conversations. Once we can understand how people want us to communicate to them and with them and listen to them and their individual needs, then we take steps really to provide information that can both educate and influence people to take steps, again, meeting them where they are in their healthcare. And as we think about when it comes to changing medications or improving medication use, this is not just a decision that an individual makes on their own. This is a decision, and these are actions that people need to take in concert with their healthcare provider. So that is a potential hurdle, isn't it? We need to help people have that conversation with their provider. So that's where MedSavvy has of tools or options to help people take some action. What are the specific actions that we're asking people to consider or that we're raising awareness of? Well, the first is just to start on the best medication for you. So MedSavvy makes content available through a variety of channels, again, depending on the preference of the user. You can access it yourself. We're partnering with providers to make the content available. We are, whether it's a mobile app or whether it's, a mobile-enabled website or a desktop website, right? So making that content available in a variety of ways so people can start on the best drug. The next is perhaps to switch a medication. You've been on a medication for a period of time. Perhaps it's not working so well for you. Or perhaps the market has changed. There are new products, better products, the prices of products have changed, and we can present to an individual patient and or their provider options for a person to consider switching. Again, we are interested in communicating that message to the individual user and their provider in the way that they are interested in receiving. Similarly, stopping medication. So we have to modify medication use by either switching or stopping. Perhaps the medication has a new safety warning, or the patient has been on the medication a prolonged period of time and the risk-benefit of that medication changes. We know that's certainly true for a variety of drugs. The longer you stay on it, the benefit can diminish and the risks can increase. So we want to make sure that we're pointing that information out to people so that they can act on it and again, communicate it in the way that they are interested. And then finally, the fourth behavior that we're trying to influence is sustaining on the medications that are delivering great value to a patient. So high-value medications that prevent bad outcomes, like bisphosphonates for osteoporosis, they prevent future fractures, or statins after having a heart attack, they prevent future heart attacks and strokes. We want people to maintain on those medications because particularly if patients are having side effects, so we want to prompt a reevaluation and a continual engagement of that patient in their health so they stay on these drugs that can deliver real health values for them over the long haul. So we're listening to the patients, listening to our users, how do they like to communicate, and provide them the information that they need. Ultimately, this can help people make better choices about their drug therapy, which ultimately should deliver better health, which, again, better health lowers overall costs for everyone. If we have appropriate use of medications, optimal use of medications, we believe that these can lower overall costs. And really get back to your first slide of the presentation, which is what do we do about this accelerated cost trend in pharmaceuticals? And we believe that optimizing medication use through getting patients on board can really be helpful here.
So understanding it's early in its evolution, what's happened? How is it going? What are employers saying? What are prescribers? What are the employees saying? Consumers saying about MedSavvy? Well,
so far we're actually really proud of our success, So when we look at the first step, which is really just to get people aware of the platform, aware of MedSavvy, and register, that's a big hurdle, frankly. And in the literature, we're seeing registration of health transparency tools, which is probably the closest analogy that I have for MedSavvy. We're seeing registration rates of less than 10%. Some groups are hitting 10 or 15% after 2 years of being of actively trying to get people registered. We're seeing 26, 27% registration rates within a period of a couple of months. So I credit this to our outstanding marketing team and a real active approach, again, working with employers and listening to the employer to understand, listen carefully to employers and understanding how their employees want to be communicated with, what will make them to take action. So, some examples might be some employees respond to incentives. Some employees would like to sign up in order to have the chance to win a prize or a Starbucks gift card or what have you. So sometimes incentives are very meaningful to get people to take action. So that's certainly one way. Another way is cultural. We have certainly worked with employers who have a culture of health, have a culture of excitement, have a culture of just, frankly, an outstanding engaged culture of employees. And they might not need incentives. They might just respond to the fact that this is a good thing and this is something that can improve our health. So we're listening carefully to those employers. So first hurdle is getting people aware of the product, and we're very proud of the fact that we've got over 26% of people invited to register. The next level is once you've signed up for the product, are you using it? And when we think about the fact that, let's say, up to 50% of Americans are taking a drug, 50 to 60% of Americans have taken a prescription drug in the last 30 days, and we're getting 26% of people registering. That's pretty impressive. And then once people are signed up, are they using it? And we're seeing 64%, 60+% of people who have signed up for MedSavvy are using it to look up their medications, look up the drugs that they, or the diseases that they are dealing with, or a loved one is dealing with. So this speaks to an intuitive user design of, or an intuitive design of the product, so that people know how to use it. They can use it effectively for the information that they need. And then finally, the last step is really what we talked about a minute ago, which is, are people taking action? Can we provide them with information, but are they taking action on it? And it's not always appropriate to switch medications, but certainly when it is appropriate, we want to facilitate that. And we're seeing strong early indicators of people taking steps that are helping them prompt a reevaluation or a conversation with their provider about their medication therapy. So, you're right, Rich, this is relatively early on. We're a very young company, but the results we're seeing are extremely promising, and we're very excited about this early successes we've had so far.
Well, it sounds great, Dr. Karbowicz, and we are definitely in an environment that has undeniably changed, and there's a tremendous opportunity to really improve outcomes and reduce cost and improve quality through engagement programs that are focused on literacy, and you are definitely changing the dialogue and really transforming the industry. So it's exciting to hear that. Many of the participants on the phone today are in decision-making positions, and they are always evaluating new programs or different organizations that are offering pharmacy services. And so we always spend some time talking through critical questions, kind of really different second-level questions that our two pharmacists would recommend that participants ask folks as they're listening to or they're being presented to with different solutions. And so Dr. Lam is going to lead us through these questions and why they're important and what value that they will drive and what they're looking for in the answer. Dr. Lam?
Yeah, thanks, Rich. So we have identified 3 of these questions here, and the first one really is, does your engagement strategy include a multi-channel communication strategy to reach a variety of members? And the reason why we have this as a question is because we've seen in a couple of those slides previously that different age bands will engage with technology or just face-to-face communications differently than other age bands. So it's very important to have a multi-channel communication strategy to tailor how you communicate with a particular age band that you might be dealing with, because a shotgun approach won't work, and if you use an approach that typically won't speak to your end user, that doesn't meet them where they are, it probably won't be effective. The second question that we have is, how are providers and prescribers incorporated into engagement strategies? This is very, very important because historically that one-to-one approach that we've mentioned before was a very siloed approach. What we're getting to now is more of a coordinated approach among different people who have engagement with the end user or with the patient. So we need to clue in those providers, and especially pharmacy is one of those great examples where if we hear of an issue from the patient or the member, we can very quickly draft up some chart notes or some other ideas and send it quickly over to the provider and let them know, include them in on, hey, your patient's actually experiencing this side effect. Maybe it's time that you reach out to them to make sure that everything is going smoothly. Or maybe there's an opportunity for optimization of their therapy. And the last point is, how are you using technology to help people change their engagement behaviors? Engagement tools or programs that do not include technology will really not achieve those targeted outcomes anymore. And the reason behind that is because we are growing very, very rapidly, especially within the healthcare space. We've seen in other sectors such as travel and tech like laptops and computers that has really been transformative for them, and we're reaching that cusp right now. So now is the time to start asking that question about what other tech can we involve or that we can use to engage our customers. So those are the top 3 questions that we have that you should be asking your TDM.
That's great. Thank you, Dr. Lam. Dana, I'll turn it back to you for a few minutes as we take questions from the audience.
Thank you, Rich. At this time, we're going to open the floor for questions. Remember, you can submit questions by typing them in the chat box, and we'll send them over to the presenters. We see people busily typing, so speakers, feel free to take a drink of water before you begin answering questions. If we run out of time or have questions that need additional research, we'll follow up on those after the webinar. Okay, Rich and team, I'll pass it back to you now.
Dr. Lam or Dr. Karbowicz, I'm having a little bit of a technical issue here. I'm not seeing any questions. Are you seeing the questions from the audience?
Yeah, I do.
Hi, Rich. Oh, great.
Yeah, so the first question that I see here is, if health literacy is the key, will members have access to pharmacists for a conversation? And I'll take the first stab at it. So I think, yes, members will have access to pharmacists for a conversation. And I think this is alluding to more of the health plan side interactions. I think that will probably grow eventually, where if a patient has a concern about, maybe their medications or how the medication is being billed, or if there's better medications out there for them to take, or concerns about formulary, there will be tools that will be built out to have meaningful conversations with their pharmacists. I know MedSavvy and Dr. Karbowicz can probably talk about this more, is that their platform is actually built up to allow these conversations to happen with a pharmacist. So maybe Dr. Karbowicz, you can add a little bit more to that.
You're absolutely right, Steve. Technology goes so far. We can provide personalized information. We can provide aggregate information about patients like you. And MedSavvy when we talk about what information we're sharing with patients, we're talking about, what does the scientific evidence say? We're also sharing what do other patients say. So what are the quote-unquote real-world experiences of actual patients to inform users what they might expect from a drug therapy. So on one hand, yes, we're sharing information and we can tailor and personalize the information that's delivered or provided to an individual user. On the other hand, we're talking about extraordinarily complex topics, which is an individual's medication therapy. So we don't take that very lightly, and in fact, MedSavvy is a licensed pharmacy. We have licensed pharmacists on staff. We are not just a transparency tool or a database. We are, in fact, a licensed pharmacy, a consulting pharmacy. So we have staff pharmacists available to respond to individual questions or concerns from our users to help them with their medications. So that's a tremendous asset for that we have to offer our users, is that personalized interaction. And I mentioned early on in the conversation that there's a mutual decision that's being made here between the patient and the provider, and sometimes, frankly, patients are intimidated to talk to a provider, to talk to their doctor, or to appear to be second-guessing. So we can help patients through that. Sometimes it's just how you frame the question, right? We're not here to tell your doctor you're wrong. We're here to present information that can impact in a positive way your drug therapy. We can help patients do that. So I absolutely agree that access to pharmacists is critical, and in fact, MedSavvy does provide that service to our users.
Great answer, Dr. Karbowicz. I've caught up to speed here to solve the technology problem. Here's the second question. Do all illnesses have the same opportunity for digital/technology engagement, or just the major chronic ones? Doctors?
Well, so this is Sean.
Yeah, go ahead.
Thanks, Steve. So, based on our research, people are more likely to use an engagement tool or research medications when we are dealing with chronic diseases, unless you're taking care of someone else. So, for example, if you're a mom who is taking care of a child's ear infection, for example, you are more likely to do some research than if it was for yourself. And similarly, if you have a chronic disease like diabetes or multiple sclerosis, you're more likely to do some research and take some steps to become engaged than you would if you are, again, have a short-term illness. So we do see some differentiation in the types of diseases and the types of personal characteristics of the individual users that are more likely to be users of tools and technology.
That's interesting. That's interesting. Dr. Karbowicz, one last question we have from the audience. How do we partner with MedSavvy as an employee benefits broker on behalf of our employer group clients?
Well, so we are entering the market in a variety of, multiple channels right now, but primarily in the employer group market within the states of Oregon, Idaho, Washington, and Utah. We are available through the Regents. We're partnering with Regents right now and Omeda Rx. Nationally, we are working with our vendor partner HealthSpark. So for employers that do not have Regents, who are based out of the other states in the country, we're available and making our integrating and selling our product through that channel.
Excellent. So there's lots of opportunity for the broker and consultant community to partner with MedSavvy, and then to introduce that to their employers. And I think that's the intent, is to really establish that partnership and to help the consultant broker community understand the value that your organization has and is bringing to the marketplace, and then bring that to the employers. That's outstanding. Well, gentlemen, I want to thank you so much for the time that you've spent today talking about engagement, about health literacy. Sean, about your organization and your vision and how you're transforming the healthcare industry. Thank you both. It was a great meeting. And I'd also like to thank the audience for their participation as well. We had some good questions, lots of registrants and participants today. So thank you all, and Happy New Year.
Please look for our 2017 webinar series coming in early Q2 this year. You can always find the latest information for our RxTalks webinar series at omedarx.com/RxTalks. We will send a follow-up message to everyone on the call that will include a link to today's presentation and a recording. We'd appreciate it if you can fill out the survey when you disconnect from the call to let us know what you think about our session. Thank you for attending, and have a great day.